For the last 2 years, since November 2021, the Christian Health Association of Kenya has been running a robust integrated healthy families program, which was christened Familia Nawiri Project by the project managers from CHAK. The program targeted 10 counties which included Meru, Tharaka Nithi, Nyeri, Kiambu, Bomet, Kericho, Homa Bay, Siaya, Vihiga and Bungoma. The aim of the project was to increase awareness and education on focused diseases, their risk factors and complications, which diseases include diabetes, hypertension, heart failure, eye care, epilepsy, childhood pneumonia, malaria, malnutrition, sickle cell disease and breast cancer. The program was carried out in 12 health facilities with the aim of improving health-seeking behaviours and creating demand for screening, linkage to care and treatment. Significant progress was made during 2 years of Familia Nawiri Project. This report seeks to identify some of the milestones achieved in select facilities across the country. The report carries highlights of the program's second-year progress in PCEA Chogoria Hospital, Kendu Adventist Hospital, AIC Litine Hospital and Sabatia Eye Hospital. Our media team made their first stop at PCEA Chogoria Hospital and carried out interviews with health officers and staff at the facility in regards to the project and how it has turned out during the second year of its existence.
I have experienced Familia Nawiri for the last 2 years, and when we received the communication from CHAK that we are part of the hospitals that have been selected for the project, we started in management and we agreed that we are ready to support and to participate in this Familia Nawiri project. We've been able to achieve a lot through Familia Nawiri. We've been able to do group support, the diabetic group and the hypertension group and epilepsy group. The epilepsy support group is a big achievement for Chogoria Hospital because we did not have a support group that was existing, but through Familia Nawiri we now have a support group of epilepsy people. We've also been able to participate in World Diabetes Day last year, 2022, through support from Familia Nawiri and CHAK. And through that we were able to screen the public and we were able to identify new cases of diabetes and new cases of hypertension.
We are able to screen, identify some of the clients who had high sugars, high BPs, and we were able to refer them to our facility and even referral hospitals or linkages of where a patient felt that was their best choice.
My request is, since we have had Familia Nawiri for the last 2 years, there is a group that we have initiated. This is a blood-taking group, and we have not been able to reach all the people with the epileptic group. So I feel if we are given more time with the supporting group, we can be able to reach these people, more people, and we can give them education and awareness to help them improve the quality of their life and even reduce stigma by meeting together with the other group of people.
From the overall report, the number of people reached on all the target counties was 118,000 persons who benefited directly from various activities meant to create awareness and education on focused disease areas and their risk factors. There were also a total of 81 screening camps around the country, with a combined total of 40,500 people screened for various diseases. Hypertension screening was the highest with 32,400, followed by diabetes at 5,400 and eye disease at 2,700. Kendu Adventist Hospital, which was also a focus institution in this exercise, had a remarkable engagement with patients on all the focus disease areas. Our team equally shared a moment with officials at the hospital, who were more than happy to generously share the milestones achieved in the Familia Nawiri Project.
So far with the Familia Nawiri Project, we've had some successes and also some challenges. For successes, for patient care has improved a lot with the CMEs that were catered for by the project, and this has really improved the healthcare workers' ability to take care of these patients widely. And then now we've been able to form support groups for the patients. We've had 4 support groups so far for the sickle cell disease, epilepsy, diabetic and hypertension, and we also have a joint one for integrated, for those with all the conditions, but at once. Yeah, and this has really improved in the patient care, patient health-seeking behaviors. Patients are now able to come up as the group and take care of one another.
This program has been able to create more awareness to the community, and the number of our clients has been able to increase, and more especially the rare cases like the sickle cell disease, which its number has been low. We were able to see 10 before the program per month, and now we can be able to see 18 to 20 cases per month. Because of this, we have been able to benefit because as an institution we have a training school. So these students are supposed to take their practicals experience in the hospital, and when they come to the hospital they are able to interact with these cases.
The Kendu Adventist Hospital's success story mirrors data that project facilitators at Christian Health Association of Kenya were able to process during the 2 years of the project's existence. The project in its year 2 supported formation of new PSGs, otherwise known as psychosocial support groups. These PSGs were running as monthly meetings across the 5 disease areas, including diabetes, hypertension, epilepsy, sickle cell disease, and breast cancer. A total of 39 functional PSGs have been formed, with diabetes and hypertension featuring 26 PSGs, 8 for epilepsy, 3 for sickle cell, and 2 for breast cancer. A total of 1,359 support group members were reached during the year under review. 77 PSGs were supported in the year, where the PSG members met monthly for psychosocial support, experience sharing and learning from one another. The epileptic patients at Kendu Adventist Hospital have been linked to disability cards. Subsequently, they now have access to free National Health Insurance Fund. Next stop for the Christian Health Association of Kenya team was the AIC Litein Hospital, which has been running the Familia Nawiri Project for 2 years as well. As it turned out, a lot had been achieved in this facility during the year under review as well.
With the support of Familia Nawiri program, it has grown. The numbers have increased over time. We have also done outreaches courtesy of the support we have received, and we are glad to report that many clients are coming out. The Familia Nawiri program has also given outreach to our staff in training issues, and we now have a continuous medical education courtesy of this program.
The first thing that the Familia Nawiri has been able to support us through is the formation of support groups, which is very key in the management of diabetes. The point that are very essential for support group is that they give a platform to our patients of sharing information about diabetes and also encouraging each other about their conditions.
The final stop for the CHAK team was Sabatia Eye Hospital. As the team discovered, the program had recorded remarkable success at the hospital over the last 1 year.
So far we have screened quite a number of patients with diabetes, hypertension, as well as diabetic-related eye conditions. We have screened around 11,000 patients over the implementing period and diagnosed around 7% of the patients with diabetic eye diseases. With the support of Familia Nawiri, as well as under CHAK, as well as Novartis, we have been able to screen and manage these patients appropriately. We have been able to improve on the number of screening days. Initially, we are doing 1 day vitreoretinal clinic, but because of the numbers, we have increased the number of days. Now we are doing 2 days screening as well as the surgeries. Again, still on this, the number of screening, we are able to make decisions in terms of what drugs to stock in the facility, especially the emergency drugs. Sometimes we screen these patients, they have very high sugars, some of them have very high blood pressures, and since we are an eye facility, we are not able to manage in this facility, but yet we cannot send them away with very high sugars. So this data has also helped us as a facility to make a decision to be able to stock emergency drugs for us to stabilize the patient before we send them to a physician. Alongside implementing the Familia Nawiri project, we are also been able to do continuous medical education, which is very key to our healthcare providers. Otherwise, we have worked with Familia Nawiri. They have supported us so much, and as a facility, we really appreciate the support that we have received from Familia Nawiri, CHAK, and Novartis as well.
Hii kazi huwa inanifurahisha kufanya, maana wakati unaenda unafunza hawa wagonjwa, unawaelimisha, wanagundua shida ambayo inakumbana na wao, ukipima presha yao ama sukari na unawaelezea watafute utafiti wa daktari, wanafanya hivyo. Wakirudi kama wamesaidika, mimi kama binafsi huwa tena ninasikia vizuri na ninafurahishwa. Kwa hivyo nataka kurudisha shukrani zangu kwa Familia Nawiri. Nasema ya kwamba tangu nianze kufanya nao kazi, tukafanya nao hii project, imekuwa ya manufaa na imesaidia community. Wengi wameelimishwa na wengi wamebadilisha maisha yao, kwa sababu kwa kupitia kwa kuelezwa na kuelewa hali ambazo wanapitia.
At the end of the year under review, it was clear that great success had been achieved through the program. The project saw improvement in patient self-care through increased number and consistency of PSG meetings, integrated support groups, and use of DPEs for patient education. There was also improvement in quality of care at health facilities with increased focus on areas such as heart failure, SCD, and epilepsy. Equally, the project was responsible for the integration of services and the rolling out of interventions to other areas.